My name is Ashlyn Heniff. Today I will be sharing a video tutorial on how to collect blood from the popliteal sinus in anurans, or frogs and toads. The authors of this tutorial have no conflicts of interest to disclose. Traditional anuran blood collection techniques include venipuncture of the ventral abdominal vein, venipuncture of the lingual venous plexus, and cardiocentesis. Each of these techniques can be technically difficult and may pose risks to patients, especially if attempted without chemical restraint. Popliteal sinus venipuncture is an underutilized and minimally published alternative anuran blood collection technique. Popliteal sinus venipuncture is technically simple, can be safely performed without chemical restraint, and permits relatively large blood collection volumes. This is a cadaver photo of a dissected hind limb in a Puerto Rican crested toad focused on the stifle. Proximal is to the upper left of the screen, and distal is to the lower right. Note the relatively superficial location and considerable size of the popliteal sinus. Given its anatomic location, blood is most easily collected using a caudomedial approach. To collect blood from the popliteal sinus, the animal is manually restrained using an encircling grip around the pelvic girdle. With the ventrum facing the phlebotomist grasps the distal hind limb and gently extends it. A 25 to 27 gauge, half-inch or 1.3 centimeter needle and attached syringe is advanced towards the stifle at an approximately 45-degree angle, using a caudomedial approach while maintaining negative pressure. After the needle is removed, the restrainer can apply manual pressure over the phlebotomy site for 15 to 30 seconds to stop residual bleeding and reduce risk of hematoma formation. If necessary, the phlebotomist can rinse gross debris from the site using sterile water or saline. Scrubbing the site with gauze is not recommended, as this can damage the thin epidermal layer. Chemical disinfectants are not recommended, as these can result in inflammation, epidermal necrosis, or even toxicosis. While phlebotomists may have an ergonomic preference, either hind limb can be used for blood collection. A potential downside of this technique is the possibility of obtaining lymphatic fluid or a visibly lymphatic fluid contaminated sample. If this occurs, the sample should be discarded and the attempt repeated with a new needle and syringe. In systemically healthy anurans, collection volume should not exceed 1% of body weight. In animals with clinical disease, a reduction in collection volume to 0.5% of body weight can be considered. The authors of this report have utilized this technique in hundreds of anurans without any complications beyond occasional hematomas, which resolved with time and did not appear to adversely affect the animals. No cases of nerve or musculoskeletal trauma have been observed by the authors. While popliteal sinus venipuncture is easiest in larger anurans, the authors have had success with this technique in anurans as small as 30 grams. For small species, it is often easier for the restrainer to cup the patient in their hands, as shown in this video, rather than using a pelvic encircling grip. We hope this video was informative and will provide veterinary professionals with a reliable, accessible, and safe alternative site for anuran blood collection to continue to advance the standard of care for this taxon.